On any given day, some 800 inpatients, 800 outpatients, and over 240 emergencies are cared for in one of Ireland's busiest hospitals, Cork University Hospital.
It will take just one patient to come in. That just completely stops you and reminds you that, whoa, this is somebody's worst day of their lives.
On any given day, some 4,000 staff come to work here, a place where life-changing decisions are made every minute, and every decision counts.
Because I see a lot of sadness, I get great pleasure giving people the good news when I can.
Here I am, hold my hand.
You're having a heart attack.
Filmed using 27 cameras following patient journeys across the hospital, each story in this series was captured in just one single day. Together they tell a bigger story of any given day.
I'm here for a long haul, you're not getting rid of me.
I just broke down. What is going on?
I'm getting the chance she didn't get, so I have to grasp it.
A good shift is where you come out the door happy, thinking, I made a positive difference today. And that's really it.
Gardaí, please. Garda in Cork, yes please. Thanks a million. Hi, my name is Kate. I'm one of the CNMs here in the emergency department in CUH. Can I let you know about a patient that's after leaving the emergency department that is confused and we're concerned about? He's under the influence of alcohol at the moment, but he also has an alcohol-induced, say, encephalopathy, so he is confused, he does not have capacity, and we are concerned about him, and he is also left with an IV line in his arm.
A 5-year-old child is being rushed to CUH. She is barely conscious and her vitals are poor.
There was a real panic there to get her in and get her seen, because the man in the back of the ambulance was like basically trying to call her. He was really roaring to call her. She was barely responding to that. He started on the head then.
We received a call from the ambulance crew. A 5-year-old little girl, Fia, is coming with complaint of vomiting, and her heart rate is low and her blood sugar is low. She's still vomiting, so we need to treat all these very fast.
There is a bit of a vomiting bug in the house. Her older brother had the same kind of situation yesterday, but nothing at all to this extent.
Right.
A heart rate of 80, irregular though, but pacemaker.
Oh, pacemaker.
Yeah.
Okay, let's quickly get a line here and then.
Pia is practically unconscious. She just looks barely breathing. And there's just nurses and doctors just swarming around. I feel like I'm half in the way, but don't want to be stepping back, but I also don't want to be in the way. So like, it's just a head full of emotions there of like, where do I go? But I don't want to go anywhere.
Okay, sweetie.
Trisomy 21 pacemaker, any other history?
Just the Down syndrome, and after 5 months I think there was 2 holes in the heart repaired as well.
I was with Fia all day long, and then she vomited. But like the fact that she was just so good all day long, happy out, playing, and just click of the fingers, and she was wiped out. She goes downhill really, really fast. It's scary just how quick.
It is 1.36, pH is 7.315, bicarb is 22, sodium is 140. Oh, good girl. She's the best girl. Yeah.
She was becoming unresponsive. It was getting harder and harder to actually keep calm.
sweetheart, you're all right, love it.
Surgical oncologist Mark Corrigan has just started his shift. He specialises in preventative surgery.
We know much more about cancer than we did 10 years ago, 20 years ago. And the different treatments that we have are really, really effective. They don't work for everybody. But for a lot of people, they do. You know, there's nothing nicer than, you know, when you give good news to somebody, say, look, okay, you've taken them through that horrible moment of, okay, we've got a problem and we have to do something with the problem. To that moment, maybe a couple of years later, when you finish the follow-up and the surveillance and everything else, and you say, we've done what we had to do and we'll see you again, maybe in Duns or somewhere else, but not hopefully here.
Today, Mark will operate on Antoinette O'Keefe. 6 years ago, Antoinette received a diagnosis of aggressive breast cancer.
I'm not a big drinker, I don't smoke, so I was thinking like I'm doing all the right things to prevent cancer coming to my door, and yet it still came. We went up into bed and literally I turned and said, good night John, I gave him a kiss and we turned and he cuddled over, he was like, put his hand on my chest and he goes like, what's that, Nat? I was like, oh, I don't know. It's like, nothing. I said, hang on, I better check now again. So I sat up in the bed and I was like, no, that's something. So that's definitely something. I don't know where I'll be afterwards.
Here.
Are you wearing it? All ready for everything?
That file.
Okay.
I remember being told on the Friday the toy show was on. I had toy show bags made up and I remember sitting there and I kept crying. I hadn't told the girls. I kept crying thinking, oh my God, is this going to be my last one? Like, afraid it was going to happen, something bad was going to happen. And I kept saying like, is this going to be my last one? Oh my God, please let it be my last one. I haven't had enough time. Sorry, I get emotional. But yeah, that was the really hard part.
8 o'clock last night.
You never think it's going to happen to you. And then when it turned out it was something, obviously, the whole world changes immediately. You know, it's like somebody just turns on a switch and everything changes.
You've no heart surgery, no pacemakers?
No, not like that.
Yep. Yeah.
I had to have a full mastectomy. That was totally different. Looking down that day and I was like, holy shit, like it's gone. Excuse my language. I was like, holy shit, it's gone. Like, and it's just, it was weird.
To be honest, having had your surgery done recently, I expect they're fine.
While the mastectomy on Antoinette's right breast cleared her cancer,
in my hand.
tests revealed that she has a variant to the BRCA gene, which means that the chance of developing cancer in her left breast is very high.
One of the questions you're going to
She has made the hard decision to remove that breast and is in CUH today for a mastectomy and reconstruction.
Well, Antoinette.
How are you?
Good. All set?
Yep.
Yeah?
It's really been out.
All set as well. Okay. I've known Antoinette quite a long time now, and I mean, she was very clear. The minute that this was identified as a potential cause, it was no. It was, I want to take control. I want to manage my own risk. I want the information, and what are we going to do about it? Plan is today mastectomy on the left hand side to reduce the risk. We'll be taking the nipple and the areola, and then Mr. Josh will be doing the reconstruction with the implant. No surgery underneath the arm today, so different to the last time. Any questions you want to ask us?
No, I don't think
No, just get on with it, Mark.
Yeah, just no.
All right.
Thanks.
All right. We'll see you inside in a little bit.
Thanks a million.
All right. See you guys.
This is something I get to do. I know I have this gene. So I had my tubes and ovaries removed in March. I'm taking something that I know right now is healthy. I'm taking this breast away. I'm like, and I'm going to put myself through the surgery again. Thinking of my kids, like I'm here for a long haul. They're not getting rid of me.
Oh my God, how did the wedding go? Yeah.
Fabulous.
Have you any photos?
It's so long ago now.
And did you go on any honeymoon or anything?
We went to Italy for a week.
Oh, lovely, lovely. Let's see how ugly you are. Go on. Oh, jeez. You actually look like you belong in a movie.
The paediatric allergy clinic in CUH is busy. Patients here are treated for a range of challenges, including food allergies.
I was trained in Peru, then I went to Spain, and then I finished with my fellowship doing pediatric allergy. Cork has one of the biggest pediatric allergy services in the country. So I said, this is a good opportunity, so I wanted to come here, and it changed my life. In 90% good things, 10% more stress. We need to sit down and tell them about the awareness of this, you know, that we are allergic and we need to carry the EpiPen all the time. Okay?
Yeah, perfect.
11-year-old Kieran O'Connell was diagnosed with a severe peanut allergy at an early age.
I can't eat peanuts or else I'll start getting sick and my throat will start closing in. And I'll have to get a needle in my thigh there. And I kind of have to carry around the medicine bag all the time with me, whenever I go places. Kind of annoys me sometimes. And I won't have to check the ingredients on anything, because every time I have something I just have to check it, so.
In Kieran's case, peanut, that is life and death. At 11, he's very clued in, he's very aware of it himself, he checks packaging more than us. Still, for 11, it's hard to put that into your head to say that you could potentially die from this. If ever the worst case scenario ever came and he went to anaphylactic shock, his system starts shutting down, rash forms, cough, the usual, gasping for breath. So obviously that's when you need your auto-injector and the shot of adrenaline. He needs to be brought to a hospital straight away.
EpiPens are the things that you put in your leg if you eat a peanut or whatever you're allergic to, and they sometimes they look like this. They can be other types as well. And I have 2 for just everywhere, and then 2 for school.
Kieran is in CUH today for an oral food challenge. He is hoping the test will show he is no longer allergic to peanuts, which would mean no longer having to carry his life-saving EpiPen.
The oral food challenge, they come to day ward, and we will introduce them low doses of, for example, peanut, until we get to an amount that is approximately between 6 to 12 peanuts, and they don't have any reactions after 2 or 3 hours. We can safely say that they have an oral food challenge negative. Are you praying?
No.
Okay. How are you?
Good.
So what are you trying today?
Personally, I think today is Kieran's last chance of maybe passing the test. For Kieran, it would be life-changing because it means he'll never have to inject himself, never have to worry about anaphylactic shock anymore. And he can just go on with his life, eat what he wants, and just be happy.
And do you eat other nuts?
Oh, yeah.
And this is an important question. If by any chance we're lucky and you eat peanuts and you don't have a reaction today, will you start eating peanuts at home?
Yeah.
Okay. Crossing our fingers. Don't pray.
Yes, thank you.
Okay.
It is going to be weird. Kieran is physically going to take a peanut, an actual physical peanut. It's stage by stage by stage, an eighth of a nut, a half a nut, and they're just going to try to push Kieran's tolerance as much as they can.
This is Murphy's Law. No, it only takes one person to introduce it at home that has an anaphylaxis, that maybe they don't know how to use adrenaline and has a really bad output or outcome, and then everything is a mess. So that is why it's so necessary that every challenge has to be in a hospital based.
So intimate, I want you to write down this. Alright, Pat? Good man. Well done. And then take a drink of water, baby.
Every time that we're doing that, we're also observing them, looking if they have the minor reaction or whatsoever, because we need to look if they're going to start having an anaphylaxis, because we need to act quickly.
Five-year-old Fia was rushed to CUH earlier today. Staff have worked to stabilise her, but she is still very ill. Shortly she will be scanned so the team can investigate further.
All the best. No worries, man. Alright, take care.
When Fia was born, it was just like any other birth. If Fia was born and then There was like a bit of silence in the room. Like the nurses were checking her over, and like we just thought it as that. Like
it went really quiet, and I was saying, "What's wrong? What's wrong? What's wrong?" And then one of the nurses said, "I think that she has Down syndrome." So I didn't know what to say.
We didn't know that, and any of the checks prior to that, there was nothing they saw that indicated anyway. Very short time when Fia was born, her oxygen levels kept dropping. She had to be brought down to neonatal. So we had maybe 15-20 minutes or so of holding her between us.
I wasn't allowed my phone in the NICU, so like I just spent hours staring at her, and I'd be just drawing out little hearts with my fingers on her. That was like me just being able to touch her. I wasn't allowed, I wasn't able to hold her or anything, because she wasn't strong enough for her.
Lay down, Fia. I'm here.
Daddy's there.
I'm here. During the Fia's time in neonatal, to see her fight through that, and like from day one, just come out fighting. Good girl. Seeing what she's went through, none of us should be complaining about anything. We really shouldn't.
Oh, listen. Stay still now. Stay
She
still.
keeps moving. Is it okay if you stay with her for the x-ray?
Yeah, it's fine.
I might get you to stay with her please, because that's a good position here.
CUH is like a beehive. It's just everybody's so busy, they know what they're doing, and if you don't talk bee language, it doesn't look like you know what's going on, or it doesn't make sense, but everyone's getting it all done.
In charge of that side of things, and I'll ring you when she goes out to recovery.
Antoinette has made a choice to have her breast removed.
I'll give you 30 seconds.
Although it is currently healthy, she has a harmful variant of her BRCA gene, making her more vulnerable to the risk of developing cancer.
Once I have an idea of what time she'd be out, I can be back.
And again, I actually can't tell you.
Oh, I know.
As I say, it'll take as long as it takes.
John's my rock. We weren't together 6 months and he proposed. I think everyone thought we were insane getting engaged. I said, "Are you sure you don't even know someone after 6 months?" John was 21, I was 24. Here we are, 17 years later.
We've grown up together really, and that, and we've built a life, and we've been best friends, and that all down the years. So it's been incredible.
The first part of the operation will be to remove Antoinette's breast. The second part will be a reconstruction, which will be carried out by consultant plastic surgeon Justin Chatterjee.
What we're going to do, I'm going to just do some marking. Is that all right?
Yeah.
Okay. All right.
Before you do that, I'm gonna get out and let you do this.
Are you sure?
Okay. Yeah.
Do you have any? We'll give you a phone.
I'll touch you before you leave there. Okay.
Oh yeah, absolutely.
I found it hard to be inside her.
Yeah. 1 second.
They were drawing the lines on her body, and it was upsetting her. I didn't want it to be seen that it was affecting me as much either.
Your arm up there for a second.
He held my hand through the whole lot of it. Every appointment, everything. Every moment of weakness that I had, the negative thought, he'd leave me run with it and say, "Okay, that's it, Mendes." He told me his fears too, and his fear was like losing me. He's my soulmate.
I went, had coffee, just took a moment, and came back then and was, you need to be strong.
Okay, dude.
Kieran is being tested to see if he is still allergic to peanuts. A negative test will mean he is no longer at risk of a fatal anaphylactic attack. He has had 2 small portions of a peanut so far.
They taste good. They taste good.
They came over then to do the third part test, which was a half peanut. I think the nurse made a joke. She goes, "Do you like it?" He goes, "They're very salty." I told him, "Sit back, relax." He was on his tablet. And he did give kind of 1 or 2 little small coughs. Like, I was just staring at him, thinking, "Oh, go on, Kieran, keep going. I hope you get to stage 5. I really do. I really hope you do."
Yeah. Just keep thinking about what you're having.
Just think positive.
Yeah, eating you.
And they were looking, and I just went like that. I just tapped my ear like that. And they looked, and you could see all these bubbles forming along Kieran's ears. And the nurse called Dr. Trulio, and just pure professional came over, and he goes, "Okay, that's the end of the testing."
This is a positive reaction.
And that's when Kieran obviously got very upset. I think he was gutted, actually. Yeah.
A little bit white dots here that you're having that makes a reaction, okay? Okay, sir, I will tell you something important, okay? So, don't worry. This is not going to be a problem. We need to make sure that you're okay and giving you that. Do you want to eat peanuts, no?
Yes, you want to get a Snickers on the own.
I know, it's disappointing.
Yeah.
I know it is. You did a really good job, though. You should be so proud of yourself. Yeah, I know.
Give Kieran his adrenaline then, and literally within, that's 30 seconds, the tingling was gone, and he just felt way better in himself. So I really hope that's stuck in his head. What adrenaline does to his system basically just gets him back to normal. He hit home then how his whole face changed, rash started forming in his body, his ears became red and blistered in the space of minutes. His bag needs to be with him the whole time. Or his injectors need to be with him, literally, the whole time.
Okay, last couple of things. How do you feel? Good. Bump it. Okay.
Now we know that he's allergic, and now we also know that he needs to be careful and take things seriously.
Have you tried pecans?
Pecans? No.
Okay. How about Kinder Bueno? Do you like Kinder Bueno?
Yeah.
Okay. So I'm happy with that. Kinder Bueno is okay. Nutella is okay. Just please, no Snickers.
Yeah.
No these kind of things. Okay.
Yeah.
Okay.
We've never used the EpiPen. We have a training pen that he has practiced on himself.
The only thing that you're never going to eat so far is perfect. Solved.
If it does come to it, will he actually inject himself? That's a massive fear. Do you know the fear of sticking a needle into your own body?
I know they would save my life, but I think they would hurt. Take off the top lid, then you push it in around there until you hear a click, and then you just hold it for 10 seconds. The medicine stops my throat closing in, and it stop me, help me to breathe again and stuff.
It is life and death. That's the bottom line. It comes down to that. It literally comes down to that. It's again party, school. When I hand over the bag from now on, it should be a case of this is Kieran's medical kit that needs to be used that will save his life, and that is the fact of it.
There are 2 lovely strong painkillers, and they'll make the head feel nice and relaxed, maybe a small bit fuzzy. We'd follow the baby.
After a diagnosis of cancer in her right breast, Antoinette had a mastectomy. Tests showed she has a mutation of the BRCA gene, increasing her chance of breast cancer into the future. She has decided to remove her healthy left breast, followed by reconstruction.
We tend to focus on surgery as if there's a surgeon, and in this case there's another surgeon, but actually, you're looking at about 10 people.
2 arm boards, please. Thank you.
The role of the surgical oncologist is to perform the risk reduction mastectomy. What we want to achieve is that we've removed as much of the breast tissue as possible, and the role of the plastic surgeon is to perform the reconstruction.
Okay.
And then we may have to take some of the wrap away.
Yes.
Bring the scarring.
Thank you.
The people that we meet who come into a hospital, it's a really unique situation because you're parachuted into the middle of their lives and to the middle of their confidence, which is a huge privilege.
Yeah, I might swap. Yeah. Thank you.
It was never going to be an option that I was going to keep my breast and risk it. I know I have this gene, let's get ahead of it. I don't want to be in my 50s or my 60s or my 70s or even my 80s fighting breast cancer.
And can I get 2 Alice's off you, please? Yeah. You are meeting people when, yesterday they were on their way to work, and today they've just got news that's completely changed that. And so the things you were worrying about yesterday just are not what you're worrying about today. And on a human level, I suppose you're frequently reminded, I suppose, that, for any of us, we don't know what's around the corner. It's just, yeah. But when they go home and they're trying to process all this and they're having a cup of tea or they're just having a cry, and that's where you see the incredible importance of the people around them.
No. Okay, I'll come back to it. There's something
there.
Okay.
Hi John, Mark here. Good, everything went very well. Yeah, no, we're pleased with that. So I suppose Antoinette will be waking up in the theatre now in the next 5 minutes or so, because I promised her we'd bring in the minute we were done. So she's only going to be coming around. Once she wakes up, she'll be out to recovery. Perfect, that's plenty of time. Not at all, John. All right, take care. See you, bye-bye.
Are you not going home?
Oh, I'll be going at 6.
Oh, 6? Oh,
Yeah.
Have you eaten yet?
I have, yeah.
Good girl. Turn around. Owen was here. Sweeties.
Oh, that's very nice.
I know.
I'll have the crackers.
Just 50 minutes ago, Fia was rushed to CUH by ambulance. She is now being moved to the Paediatric Emergency Department and will continue to be monitored closely. She is stable but remains unwell.
She has any siblings at home?
Yeah, she's a brother at home.
Brother. How old is he?
He's 6.
6 years.
I was at home with Finn. I do go into a panic like when I see her like that, it's scary. Darren can keep calm,
As much as you can't do anything to help it as a sense other than be there and support Bev support me, be there for Fia. To myself and Bev, family is everything.
No, her numbers are all good now. I will just send her blood samples now there and we'll come back to you, okay?
Okay.
Yeah. And we'll keep an eye on her numbers there, okay?
Okay.
Yeah. Thank you so much.
Perfect, thank you.
Down syndrome, it's not all that she is, but to me it's the best part of her because, I wouldn't change a thing about her. Like, she's amazing.
It is challenging, but it's not the end of the world. If I could say anything about it now, it's not to be scared of. Because she's a great girl.
We're at the front line. When you walk into the emergency department, you really can't expect what's going to be thrown at you, what you're going to face, and you don't know whose life you'll impact that day.
I got a call, and it was from Christy. He said, I'm in an ambulance, and he's having a heart attack. All of a sudden, you're sort of, what did he tell me? It's a frightening thing, He's my only brother. I have 9 sisters now, but he's my only brother.
Christy Jacob has been rushed to CUH from University Hospital Waterford. He's had medication for pain reduction but is having a heart attack and needs urgent treatment not available in Waterford at this time of night.
Hi there. Hello. My name is Simon. I'm one of the doctors here. And what time did the chest pain start?
Started about 8 o'clock.
8 o'clock. It's a good thing you came straight to hospital. Can we get a repeat ECG on him while he's here?
Yeah.
You know that you've had a heart attack. They've told you that, yeah? What has his blood pressure been en route? Hey, Dylan. This is Dylan.
I want to listen for a second there now, 1 second.
Because the transfer time from Waterford to Cork University Hospital, because on blue lights, is around an hour. They do have to treat it before they transfer the patient over to CUH. And the treatment which then is given is to try and attempt to dissolve the blood clot, to limit the damage done to the heart muscle. In Christy's case, unfortunately, the thrombolysis had not worked. So time is key.
Okay, you've almost certainly got a blocked artery in your heart, okay? We gave you some medication in the water to try and unblock it. Yes. And it hasn't really worked as well as we thought it would, okay? So we're going to need to proceed ahead and you may need a stent.
Registrar Dylan Finnerty has been in constant contact with consultant cardiologist Richard Tanner. Richard is at home but is on call for emergencies and has made a decision to activate the cath lab. He has 30 minutes to get to CUH along with 2 specialist nurses and a radiographer.
Where's the fire myself?
Healthy up until now.
High blood pressure? Do you smoke? How many per day roughly?
About 50. Recently, I'd say 5, 10, whatever.
Asthma?
No.
And heart valve? Good stuff.
Thank you. I don't smoke anymore.
You see so much in the emergency department. You see so many illnesses. You see patients at their sickest.
What causes all these blockouts?
Cholesterol, smoking.
And it makes you appreciate the little things in life, you know, going back home to your family, trying to get as much out of life.
You don't really know what's going to happen, you know. Even though they're treating you, you can still die. Things can change in an instant.
I only want to know that I'm going to come out the right side.
Yeah, absolutely. I guess what we can say at the moment is you're having a heart attack.
Yes,
okay?
I was told that.
If we do nothing, okay, there's much greater risk to you. So we'll get you sorted. We're just waiting to go down now.
Thank you very much. I really appreciate all this what you're doing for me.
Doctor, sorry, this is a very temperature. The
Yeah.
thrombolysis.
Yeah.
Very good. 9,000 units.
You're on tour. Appreciate it, ladies.
Yeah, there you go.
Thank you.
All right.
Not allergic to anything?
No.
So what we'll do is we'll lie you flat on the table.
Yeah.
We'll go through the little artery at the wrist, okay? So preferentially we go at the wrist, sometimes we have to go at the top of the leg instead, alright? We thread a very fine wire up the arm, then into the chest, we inject some contrast dye and take some x-rays at the center, and we're looking for a blockage, okay? So if we see a blockage, we try and relieve it. Okay. Alright, we'll get you down. I can push if you want to. Appreciate it. Yeah.
I'll put the file.
There was one patient that came down and we were all tipped off before he came down that he needed to be called JC and not by his real name. The patient himself thought he was Jesus Christ, so we had to call him JC, because if he was called by his real name he would have gone ballistic. But unfortunately one of the surgeons came out to meet him and he looked down at me and he says, "Good morning JC, how are you? My name is Mohammed." And the patient looked up at him and held his hand. He said, "I've waited all my life to see you."
How's that pain in your chest now, Chris?
Still there.
Christy Jacob is having a heart attack. He was treated in University Hospital Waterford before being rushed by ambulance to CUH.
First floor will probably be quick as well, just go up one and then go down one.
Whatever you think, yeah, that's the quickest route, probably the best.
Stabilised in the emergency department, he's on his way to the cath lab. On-call consultant cardiologist Richard Tanner has made it to the hospital within 30 minutes.
When an artery is completely blocked, we know that the extent of damage is dependent on the time that artery remains closed. When it remains blocked and blood supply is cut off, it can lead to extensive damage to your heart. Even if we open up the artery at that time, there's a certain amount of muscle in his heart that will be dead and it will be irreversible. And the consequence of that is heart failure. So time is critical in the treatment of heart attacks.
You think you're invincible, but you're not. And when this kind of highlights the fact that you're mortal. He's a master butcher, and he loves his meat. Fish is for cats. That's what he said. We're all guilty of overindulging and all that, but if it affects you that badly, you have to kind of stop it. Sing at the drop of a hat, and he likes women. He's never married or on, so he's a single man. He's a man about town. He can do what he wants. Kind of a party animal in a way, but he's an older party animal. You kind of can't blame him until something happens to you.
Can I take stent, please? To keep the artery open, we place the stent, which is like the scaffold that keeps that artery open. So that stays in your body and it'll be there for the rest of your life.
No, almost done. Ready? Almost done. So Christopher, you stent in and the artery opens up, okay?
He's a kind man. We want him around as long as we can have him.
Okay.
Five-year-old Fia continues to be monitored in the paediatric emergency department. She will be admitted when a bed becomes available.
Oh, thanks a lot. Thank you. Bye. Maybe because of the vomiting, the white cells in the blood is little bit high, but her CRP, like a kind of infection, is normal. Nothing to worry, like because of the vomiting, her white cells are high.
Okay.
So anyway, they will follow up her in the ward there, like, you know. If
They'll take more bloods there and so on.
Yeah. Her primary concern to the hospital for Fia is now dehydration, vomiting and sugar, hypoglycemia, not because of any cardiac issue or trisomy 21 or Down syndrome. She is in the hospital. Only thing, the dehydration. So we are treating her dehydration now.
Today, Brian Murphy is scheduled for complex surgery to try and ensure he can continue to walk into the future.
For the last couple of years, he had an awful lot of problem walking because he had so much trouble with his knees. Couldn't really walk very far. And if he was walking then, it was at a snail's pace. And I'm like, will we ever get home?
I've played a lot of football at the Bath Club now. This might have nothing to do with it, but I had terrible trouble with my knees. Eventually I had to get them done. The pain was chronic, it still is.
I mean, this is a bigger operation.
Oh, I don't know, but
Brian would be in pain every time he tries to walk. He's quite a stoic character. He's a man who doesn't complain, and I know that if he's complaining of something, he's genuine. The older you are and the frailer you are having a surgery, then the less likely you have of a better outcome.
Morning, Brian. How are you?
Good.
Good. So, we're going to do your surgery this morning. Right.
It's now causing him significant pain, and the only solution that I have to be able to reconstruct this for him is to give him a total femur replacement.
I've no hearing aids in.
You thought I had to replace just the knee, but I have to replace the whole femur.
Yeah.
So once you have to replace the entire femur, you're essentially replacing the entire knee and the entire hip in one go, and then replacing the entire femur at the same time.
But I don't think you have a choice, because I think that this thing is completely loose and you've got so much pain you can't walk on it. So we just have to go ahead and do this. Right? You can say, look, I don't want to do it, but I don't think you're going to be able to walk and your pain won't go away. The challenge of trying to look after somebody with a problem that's more complex is challenging you to try and improve as a surgeon. If you do only simple things all the time, you never get better. So you have to try and step up and do more complex things. This is a big surgery. Right, there'll be a reasonable amount of blood loss in this.
Just worried how long to take you to know.
You shouldn't be worried about that.
Pushing like just...
Oh, I know that, yeah. I don't know how long it's going to take. It'll just take as long as I need to get it done safely for you.
You put your trust in them, and then for those 5, 6, 7 year olds, whatever he does, we'll have to.
It is a substantial surgery. It's going to take a bit out of you. You may need a bit of blood or something like that afterwards.
People like Brian, they can lose a lot of blood. The other worries you have with people like Brian are the risk of clots. And there is the very rare patient who gets a severe clot in the lung and that can kill them.
Here. How are you? Have you eaten? I get you something?
Antoinette is recovering from her mastectomy and breast reconstruction surgery, an elective procedure prompted by discovering she has a variation of the BRCA gene.
I am lucky. Yes, I have the gene, but I'm ahead of that now, so I feel I'm incredibly lucky to get this far.
Your hands.
I get to see my kids grow up. I get to see them graduate from national school to in secondary school, getting on with life.
The gene obviously could go into the future. The girls will be checked as soon as they're 18 and they'll have consistent, I assume, testing and that going forward, so that at least they'll always be monitored. Into the corners like you like it.
I won the lotto of life. I win because I beat it. So that's really important. Yeah. I kept my word to myself that I was never going to lose to this.
And breathe in and
Surgeon James Harty is preparing for major surgery. Patient Brian Murphy requires a knee, hip and femur replacement to try and keep him walking into the future.
It's a substantial surgery. You have to prepare to have a patient who's on the table for quite some time.
Can the lights be put up, please? Can you put some power on those lights because they're too weak?
In Brian's case, I will start at the top, remove the femoral component, put the hip cup in and then go back down and put the knee bit in and then join the two from top to bottom by putting the femur in.
The question then is, can I get the hip out first? Just before I do that, actually, let's just see, can I get the hip?
Brian, I suppose, is the love of my life because, well, he's the only boyfriend as such, really, I'd say, that I ever had. He's kind of been the one and only.
If I can dislocate the hip first, it might be easier.
We met through his sister, Kay. Kind of got a bit friendly with him, but like Brian was always very, very shy back in those days. And like if I'd come in the door, he was gone.
Try and dislocate that hip. Try and dislocate the hip.
I don't know, it was like kind of a game of chasing. I just decided, I'm going to get you. Eventually I managed to break him down and I did. I don't know, was it a kind of a mutual decision, just that we'd get married? I certainly don't ever remember him going down on one knee, that's for sure.
I consider that this is a salvage type of surgery and I don't expect him to have the same function and outcome as somebody who might have a hip replacement or somebody who might have a knee replacement.
Okay, there's his proximal femur coming out. Okay.
It is a totally different procedure. The muscles don't attach to the bone and you need your muscle to be attached to your bone to be able to walk and move normally. And this implant will not allow the muscle to attach to the bone.
Hit it again. Here she comes. Yeah. Okay, lift back now. No, that's it. And she goes up.
My expectation for Brian would be that he would walk. He'd walk pain-free. I think he'll always use sticks or crutches. He wouldn't be able to go a long distance, but he would be able to go around and do his daily activities.
In she goes. Now give me the screwdriver, please, for that, so I can turn it the right direction. Yeah, it's got to spin. It's got to spin 180 degrees for me there. That's it. Okay, there it is. Hold it there, Sarah. She's locked. Yeah, locked in. Let's get this closed up. And we'll start closing the skin first. Okay, you happy, lads? Okay, thanks a million. Lads have just closed the rest of it. Oh.
You can't be dispassionate about the patients. You have to feel that you're giving each patient 100% when you're operating on them. So when you've finished operating on them, you have the next patient and you have to be just as passionate about the second one as you were for the first one.
Very good. Oh, when did you come? I was on holidays last week. I started Claygirl. No better girl. You liking Cork so far again? Did you say you were in Cork?
I was here before and I left for 10 years and now I'm back.
Oh, good woman. You brought the weather with you. I'm going to get a few of that Reese's cleared out. It's a bit messy. I need to fix that now.
Margaret.
Full Reese's gives me a bit of nerves in the morning, like.
Cardiologist Richard Tanner performed an emergency procedure on Christy Jacob during the night. Now he's back to check on his patient.
Hi, Christopher.
Richard.
How are you doing?
I'm doing great. I'm now all on account of you.
Do you have any chest pain this morning?
No.
Any shortness of breath?
None.
Okay.
And I didn't even have shortness of breath before I went to hospital. It's just a pain in my arm and my chest.
Yeah. Have a quick listen to your heart there.
Yeah, of course. There was damage done to my heart. And the aorta, like they call it the widowmaker. That's the one that was blocked, but they reckon it was 100% blocked, which is scary. Like I said, what would have happened had I went to bed? They said you would never woke up.
Smoking.
I smoked my last cigarette before I came in. That will never ever happen again. Never happen again.
This is really important because you could be back here again.
That I don't need.
Okay.
Yeah, I mightn't get back there next time. That's the problem. Okay. Hindsight is a great thing. If I knew then what I know now, I would have changed it all those years ago. But just having a good time all the time, I kept doing it until I had heart failure.
You're doing very well overall, okay?
Yeah, I'm happy and I'm grateful for you and the Waterford staff as well for acting fast and getting me down.
Good job looking after you.
Yeah.
Typically after what you've had, you're kind of 3 to 4 days in hospital.
You okay?
Okay.
Yeah.
All going well, okay?
That's brilliant. It's no problem.
Okay. Family calling.
I know.
Okay.
Appreciate everything you've done for me.
You're very
Thank
welcome.
you very
Okay. And the reason I do cardiology is that we had a man came in with a heart attack which could potentially be fatal or have severe consequences for the rest of his life, and now he's sitting out of bed, had his breakfast, pain-free, ready to continue his life again.
I'm not worried. They were good to me. I know, I just do by the book.
You'd have your arguments and small disagreements and nothing major, but a thing like this kind of brings things into perspective.
Thanks, Danny. Okay then.
Christy is lucky. He got caught in time. Hope he makes his own luck in future.
The relief when she comes home is it's brilliant,
Coming home from work and just run out just really warms my heart. Just want to see more of that.
I think there is life before cancer and there's life after cancer. There definitely is. There's definitely that whole thing's I live my life carefree. I love Mark. He's lovely. He's an amazing doctor. I don't want to see Mark anymore. Just for him to tell me everything's going tickety-boo, isn't it? We're grand.